Well, welcome everyone. I'm Ayana Jones, the Mentorship 365 Program Manager for the IDSA Foundation. Thank you all for joining us today for today's webinar, IDSA and HIVMA Programs and Opportunities. This is in continuation of our ID Mentorship 365 webinar series. So special thanks to our speakers today who we'll introduce here shortly. Before we get started, we have a few housekeeping matters. This webinar is being recorded and will be available on demand if you can't stay for the entire presentation. The presentation will be uploaded to our Cooper lessons if you're a part of the mentorship program, or you can access it and share it via the IDSA Foundation YouTube channel. Sorry, there won't be a dedicated Q&A session for this webinar, but please feel free to use the Q&A feature during the live event to ask questions. If we can't get to all the questions during the live presentation, we'll do our best to address them in a follow-up email. As a reminder, we are discussing the additional tools and opportunities within IDSA to support your journey in ID. You'll learn about the various programs and career pathways available to advance your career and impact within IDSA and HIVMA. And finally, as you know, we're on social media at IDSA Foundation across all platforms. So feel free to post or share your takeaways from the webinar. You can tag us using the hashtag IDM365. So finally, next, I would like to introduce our first speaker for today. Beth Orrero is the program manager for the IDSTEP and G.E.R.M programs at IDSA. She oversees the strategic planning, implementation, and evaluation of these programs. She has over 15 years of experience in leading public health initiatives that increase access to healthcare and improve health outcomes. It's my pleasure to introduce you all to Beth.
Thanks, Ayana. Thank you. Good afternoon, everybody, and thank you for joining. I will be giving you a brief overview about the G.E.R.M program today. The G.E.R.M program, G.E.R.M stands for Grants for Emerging Researchers or Clinicians and Mentorship. So the G.E.R.M program covers pediatric or adult infectious diseases or HIV, including both clinical or research activities. The project categories are 5, which are basic science, epidemiology or clinical research, medical education, structured clinical experiences, and quality improvement or program evaluation. The project period is typically 1 year, and currently we are finishing the project period that started last year that will finish in June this year, and we just finished the review process and we'll be awarding projects for the new year starting July 1, 2024 and ending on June 30th, 2025, and the award is a $4,000 stipend. So the current impact of the G.E.R.M program that we've had for the past 5 years is that we've had 357 applications and currently have awarded 143 grants up to $484,000. So the benefits, including the stipend, are IDSA membership for 1 year, and this typically includes access to electronic infectious disease journals, access to curated content in the form. We do provide a 1-year mentored research opportunity, a discounted ID Week registration fee depending on the year, and also a potential ID Week travel stipend depending on the need. Other benefits include curated content learning. We do have IDSA does have a learning management system that includes content that would be including career path content, salary toolkit content that, empowers you to have the tools and guidance to negotiate salary, connecting with social media and other ID leaders for other potential mentorship and networking opportunities, career development webinars, and message boards for collaboration by research topics or other affinity groups, and providing news and a calendar of events to national and international ID conferences and meetings. Thank you. I will now turn it back to Ayana to introduce the next speaker.
Awesome. Thank you so much, Beth. It's now my pleasure to introduce to you all Colin Dixon. Colin Dixon serves as the Associate Director of the Leadership Institute at IDSA. His background includes roles in leadership development, educational program management, and curriculum design. Colin.
Thanks, Ayana. Hi, everyone. As Ayana said, my name is Colin Dixon. I'm the Associate Director of the Leadership Institute. And first, let me just thank you for the opportunity to speak today. So I've been with IDSA for about 6 years, and in my time with the Society, a recurring theme has emerged. Our members frequently excel in their fields. So they find themselves rising into leadership roles without having had the opportunity to develop corresponding leadership skills. The IDSA Leadership Institute is our program that seeks to bridge that gap. Before I jump into what that is exactly, I think the best way to get an understanding, or at least the feel for the program, is we're going to take a look at a brief video here that features some testimonial from past participants sharing their experiences. Go ahead, Anna. We can't hear or at least I can't hear the sound. You know what, that's all right. It's not a huge deal if we can't get the
I think it's really important for the future of medicine to include infectious disease leaders.
We spent the time thinking about how to create mission and how to negotiate. These are all important skills.
So I think some of the best things that happened in the past 2 days is number 1, camaraderie, number 2, incredible speakers, and number 3, time to really think through and develop plans for your institution.
I'm walking out just feeling better about my career and my future in infectious diseases in general.
Thanks so much, Anna. So what is the Leadership Institute specifically then? So the Leadership Institute has the overarching goal. We're here to empower infectious disease and HIV specialists from across the healthcare team to forge networks of emerging and seasoned leaders from various backgrounds, to enhance crucial and specific leadership behaviors, to develop and articulate a philosophy of leadership to the teams that they lead and the teams that they serve on, to formulate strategies for planning, executing, and overseeing change initiatives, projects of all sizes, and to communicate effectively, to negotiate on behalf of themselves, their teams, and their profession, and to promote understanding and resolve conflict. So those are the goals. That's what we try and do throughout the course of these programs. Next slide, please. And we do that, or we hope that we do that, with one of 2 programs. So there's 2 opportunities within the Leadership Institute. The first, our oldest program, is the Community of Leaders program. This is focused on mid to senior career infectious disease and HIV specialists, and it includes tons of asynchronous learning via our IDSA Academy platform, a multi-day in-person intensive workshop, typically in May each year. Content in that program covers leading teams, organizations, and systems through a series of modules focused on leadership philosophy, leadership behaviors, change management, communication, and conflict resolution. So this is really for someone who's in a position to affect significant change on teams, organizations, and systems. Our second program is Rising Leaders. This is our newest initiative. This is designed for early career infectious disease and HIV specialists. In this program, again, like Community of Leaders, you have access to a wealth of learning through IDSA Academy. There's also bi-weekly group coaching sessions with a certified coach. And this focuses on self-leadership, on figuring out what kind of leader you hope to be over the course of your career. So this program includes modules on leadership styles, coaching and mentoring, communication and conflict resolution, problem solving and project management, and anti-racism and inclusion leadership. Next slide, please. But the simple truth of these programs is we seek to connect those aspiring to improve with others who share that ambition. We know, and the data's in, that effective leadership matters. We know that when leaders are at their best and perform behaviors that we know work, they're 4 times more likely to be rated as effective by their peers. They drive commitment from those that they lead in ways that cannot be replicated by broader organizational efforts. They build trust and psychologically safe environments where teams can take considered risks, and they're able to anticipate and effectively implement needed change at institutions. But none of this is done in isolation. All leadership, or at least all effective leadership, is relational. And that's at the heart of what we're trying to accomplish. We want our members to feel connected with one another, and perhaps more importantly, to have the tools they need to connect with the teams they lead and the communities they serve. Next slide, please. So if you want to get involved, how do you get involved? It's a competitive application process for the Community of Leaders program, competitive only because we're limited by space. So we can take around 40 individuals annually for this program. The application typically opens in the fall and results are announced in January. The asynchronous program runs February to May, with the in-person workshops, as I mentioned earlier, typically occurring in May. And then the Rising Leaders program, this is exclusively online. So we can take, for the most part, as many folks as would like to register. So it's an open registration process each summer. Registration closes in August typically, and the asynchronous program and coaching sessions run from September to November. Thank you all for your attention today. It really was a pleasure to share about how the Leadership Institute impacts our community. And please reach out if you have any questions. Thanks, Ayana.
Thank you so much, Colin. As a reminder, please use the Q&A button to ask questions at any point during the presentation. Again, we won't have a designated Q&A session at the end, so feel free to drop your questions in the Q&A section. So now it's my pleasure to introduce to you all Ashley Logan. Ashley Logan is the Associate Director of Education and E-Learning at IDSA. With a passion for leveraging technology to enhance educational experiences, she's played a pivotal role in developing and implementing innovative strategies to engage learners in various settings. Ashley, take it away.
Thank you, Ayana, for that very warm introduction. I'm excited to share some information with you all today about IDSA Academy. So in case you're wondering, what is IDSA Academy? It is IDSA's online platform that houses the majority of our educational resources. The Academy offers a range of various materials related to the field of ID and caters to various audiences at different stages of their career. So let's dive in to get started and learn more. So what can you find within the Academy? Like Colin just mentioned, we have some portions of the Leadership Institute. You'll find a lot of different online courses through our maintenance of certification modules, general infectious diseases 2022, a Hep C module. You'll also find some board exam practice modules. So we took the Andriel course that is conducted in person at ID Week and converted that to an online experience. And then one of the largest buckets of work that we currently have is the antimicrobial stewardship curriculum, which we will get into in just a moment. So the Academy courses are designed to be accessible and user-friendly. They're interactive and very engaging. You can use them on a computer, mobile devices, and at your convenience. So we find them very easy to use, and we hope that you do too. All right, and we have some videos that are kind of quietly running in the background just to kind of give you a sense, but we're going to start by talking about the core AS curriculum. So this was developed to provide fellows a foundation in stewardship, regardless of ultimate career plans. So it encompasses 15 hours of learning content, and that's through e-learnings and webinars and workbooks. We also added access to our bugs and drugs modules that were added just a few years ago that kind of talk about biology and pharmacology concepts. And it also has some additional resources such as pocket cards and references. But although this core curriculum was designed initially for fellows, there is a faculty version available. And so the curriculum is kind of a toolbox of sorts. There are some asynchronous pieces, kind of like the e-learnings that you see here, that you can work on your own. But the faculty version has some slides that can be used in a small group setting as well, so that you can kind of debrief and talk about all of the concepts that you just learned. There's also a self-study version available that is accredited that we offer as well. So we can move forward and talk about the advanced curriculum next. So once you have that foundation in stewardship, some of you may want to move forward and lead a stewardship program. So we have resources for that available as well. It provides learners with the knowledge and skills to become leaders in the field. It has 18 hours of learning content, advanced bugs and drugs modules, and is formatted in a similar way with the e-learning modules, workbooks, and application activities. One thing to note also quickly about the core curriculum is that I know that sometimes we have some med students or early career professionals with us today. During the beginning of the pandemic, while everybody was kind of siloed and isolated, we got grant funding for the curriculum, and we're able to provide access for over 700 medical students with that funding. So I believe that about 300 people completed the curriculum, but we were really happy that we were able to offer that incentive and that program as supplemental material at the beginning of the pandemic. So I think that's just kind of a fun fact that I wanted to throw out there. Next slide, please. So like I mentioned, we also have some MOC modules available. General Infectious Disease 2022, which was also an in-person workshop at ID Week, has been converted into an online experience, and we have an Hep C module. What I really like about the MOC modules is that they are kind of case-based scenarios, but at the end, not only do you get feedback about what was correct or incorrect, you can also see how you stack up against your peers, which I think is pretty neat as well. So we are pleased that IDSA received joint accreditation in 2021. So a lot of the content within the Academy is accredited, so you can get CE and MOC credits. We are proud to offer credits for physicians, pharmacists, nurses, and then most recently clinical microbiologists, which we received just about a month ago. So a lot of the course content is for purchase, most of it, but also a lot of it is accredited. But we are working on adding some webinars and additional content to the Academy very soon. Free webinars and more free content, I should say. So what do we have coming down the pipeline? We have an advocacy course for members. I think that Rabita and Jose might speak to that in just a minute. We have an HIV statin guidelines webinar that will also be coming out and hosted there soon. And then we're also working on a couple of workshops that will be held in person at ID Week in LA this year. Small plug to register for ID Week. So we have our first workshop is a wound care workshop, which has been wildly popular for the last couple of years. It focuses on debridement, compression, offloading. It's very hands-on. And then we're also offering and working on a new workshop for APPs that we hope to convert into an online experience after ID Week. So stay tuned and be on the lookout for those as well. Next slide, if there is one. Okay, so where can you find us? We have a direct URL here, academy.idsociety.org. We have the QR code, but if you go to idsociety.org and you click on the professional development tab, you will find IDSA Academy listed pretty close to the top there, and you can find out, go to this page and see more of all of the courses and content that we have to offer. This was just a kind of high-level overview. But if you have additional questions that you would like to ask, please feel free to reach out through that channel as well. So I think that's everything. Thank you very much, Ayana, and thank you for the time to present today.
Thank you, Ashley. Now it's my pleasure to introduce you all both to Rabita Aziz and Jose Rodriguez. Rabita Aziz is the Associate Director of Advocacy for the Infectious Disease Society of America. She leads strategic advocacy and global infectious disease policy development for the organization. Her work focuses on leveraging the voices of IDSA member experts to advance the society's policy priorities on the federal level and on advocating for the US government and multilateral institutions for evidence-based programming and increased resources for responses to global HIV, TB, global health security, and emerging infections and antimicrobial resistance. Welcome, Rabita. Now it's my pleasure to introduce to you Jose Rodriguez. He is HIVMA's Associate Director of Public Policy and Advocacy. He's an accomplished public health policy. He's an accomplished public health policy advocate with more than 17 years of combined experience at the municipal, state, and federal levels, ensuring equitable access to quality healthcare for vulnerable and historically marginalized communities. As a reminder, please use the Q&A button to ask questions at any point during their presentation. Rabita, Jose, please take it away.
Great. Thank you so much, Ayana. Hi, everyone. As Ayana mentioned, I'm the Associate Director of Advocacy for IDSA. And Jose and I essentially tag team on our grassroots advocacy work. And we're really hoping that by the end of this presentation, you'll join our member advocacy program, what we call the MAP, and start advocating with us. So members of Congress and their staff really need to hear from expert constituencies when developing legislation that impacts their constituency. Actually, Ayana, could you advance to the next slide, please? And the next one is, thank you. So as ID professionals, you really need to engage with Congress on ID-related issues, or else your viewpoint won't be considered when Congress is creating and passing bills on ID and HIV. You can advance to the next slide as well. Thank you. Whether you like it or not, since COVID, the field of ID has become politicized. It's no longer a given that Congress will support science and evidence-backed policies. So if you're not speaking up for science and ID, there may be someone else out there filling that gap and that silence, and you may not like what they have to say. They may not be speaking in your favor. So it's really in the best interest of every member of this organization to get involved in advocacy work. Our Member Advocacy Program, or MAP, is the gateway to doing advocacy with IDSA and HIVMA. Once you join the MAP, we aim to make it easy for you to interact with your elected officials because we want to make sure your voices as ID professionals are represented in Congress. The more members we have in the MAP, and the more voices from our community are engaging in Congress, the bigger impact we can have on the creation of ID and HIV legislation. Members of the MAP advocate for ID and HIV strategic priorities that are set by the Board of Directors. If you could go back one previous slide, that'd be helpful. Sorry, Ayana. For IDSA, that includes strengthening and growing the ID workforce and federal responses to AMR. Right now, we're working on a couple big pieces of legislation, which you see listed here on the slide. The one that's probably the most impactful for this group is the Biopreparedness Workforce Pilot Program, which Once funded, will provide loan repayment for ID professionals working in health workforce shortage areas. IDSA essentially wrote the bill, and it was really thanks to advocacy from members that the bill was passed. However, now it needs funding through the appropriations process to be implemented. So right now, I'm going to drop a link in the chat. There it is, for an action alert we have going right now, which allows you to contact your House representative in support of funding for bio and for federal AMR programs. We're in the middle of appropriation season right now, and it's really important for House offices to hear from their constituents, so they're more likely to support our funding asks. If you could advance to the next slide, please. MAP members also help us advocate for HIVMA's policy priorities, which complement IDSA's strategic priorities. Broadly, HIVMA is working to increase equitable access to HIV care, prevention, and treatment, and build a robust and diverse HIV workforce. 2 items to highlight include building support to establish a national PrEP program and increase funding for HIV-related programs, including support for Ryan White program funding as well. So both my colleague Jose and I worked on the Hill in our past lives, so we really understand the importance of direct constituent engagement with congressional offices. You know, we meet with and email staffers all the time, and while our work as policy staff is impactful, there's really nothing like hearing directly from experts and learning what's happening on the ground. Next slide, please. As I mentioned, the MAP is your gateway to advocating for these and other important ID and HIV policies. Anyone can join the MAP, from medical students to fellows to ID professionals who are advanced in their careers. It's essentially our formal advocacy structure to make advocating easy for our members and to recognize our members for the important advocacy work they do. We offer a wide range of ways to advocate, from something very simple like completing action alerts, which only takes a minute to do but has a big impact, to really high-level activities like testifying in front of Congress. It's our goal through the MAP to demystify advocacy and the world of congressional comings and goings, and show you that it's not only easy to advocate, but it's really your duty as medical professionals who serve your communities. We relaunched the MAP in June of last year, and since then, we've grown membership by over 130%. Which is amazing, but we need more voices, especially from those of you who are more early career and can talk about the challenges you face as younger ID and HIV professionals. Once you join the MAP and start doing advocacy, you'll earn points for different advocacy activities and be able to move up our advocacy tiers, which I'll turn it over to Jose to talk more about now. Thank you.
Thank you so much, Rabita. I'll dive into a little bit more of the MAP program, and you could go ahead and advance to the next slide, please. So as Rabita mentioned, joining MAP helps to build your advocacy skills by including you in different advocacy activities. And that ranges from digital advocacy to in-person or virtual meetings with lawmakers to testifying on Capitol Hill. It also helps connect you with other members. So it's a great networking opportunity, and it helps deepen your relationships with IDSA and HIVMA policy and advocacy staff. It also, and more importantly, really helps to open up to connections with your lawmakers. And we want to establish this relationship and your thirst for advocacy really very early on in your career. And having mentees and mentors be a part of this program really puts you in a path to have a greater and even a more unified voice in influencing the decisions that impact your very career, your community, and the patients you serve. Speaking about the structure of MAP, so MAP includes 3 tiers. You have your ally, your advocate, and your champion. And each one of these tiers come with unique opportunities for members to participate in. And by participating in each tier, you can earn points, as Rabita was mentioning, and rise your way through each different rank. As you're making your way through each tier, you're unlocking more high-level opportunities as you go, including advocacy trainings that was mentioned earlier. And IDSA and HIVMA will keep you up to date on those opportunities as they come up. But in order to participate and to start your journey through MAP, you have to join. So if you're curious about, have I joined MAP? Well, if you've already joined MAP and visited our website or taken action, you don't have to do anything new. You're already included in the MAP program. But if you're not a part of the MAP program, in a few slides, we will share a QR code so you could take out your phone, take a picture, and then join. So looking at the slide currently that we have up, the Tier 1 ally, let me walk you through some of these tiers and share how some of these unique opportunities can help you advance through the slides. So our allies are newer to advocacy. So this tier means that you have taken action on some of our action alerts, and those action alerts that we refer to are perhaps emails that you send to lawmakers a couple times a year. They're not as involved as some of the other tiers, some of our allies and champions, but they're still a valuable part to our overall advocacy efforts. And as Rubita mentioned, we both worked on the Hill, and we can't stress enough how important these letter writing campaigns are. And mind you, these letters, as you take action on them, they're already populated for you. You are able to edit some of these letters. And this digital advocacy is a really key part of our advocacy efforts. To help our allies get ready for the next MAP tier, they could participate in our policy and advocacy webinars and our trainings to really deepen their knowledge and skills and demystify the legislative process. The more actions that you take, the more points you accumulate, and then that can help you move up to the next tier. Next slide. So our advocates. So these advocates are individuals who are more consistently participating in IDSA and HIVMA advocacy. They respond regularly to our action alerts, which are usually embedded in many of the email communications that you receive from us. As more experienced advocates, they can now join IDSA and HIVMA in the meetings that we take very often with lawmakers. And you can take part and participate in some of the other benefits that are included in the in this tier. Other benefits for this specific tier include a preference who we go to as we're deciding who should be a part of policy and advocacy committees, and who we go to and pick from when we're looking at different policy and speaking engagements. For example, speaking at ID Week on the advocacy that we've been doing throughout the year. To help these individuals prepare them for the next tier, they need to participate in at least one meeting with a lawmaker, and that's either virtually via Zoom or in person. Next slide. So these are our champions. So our champions are our most experienced advocates. They have consistently responded to action alerts. They participated in our congressional meetings, and they participate in other high-level activities. And that includes authoring content for IDSA and HIVMA communications. They've also earned a preference for high-level advocacy opportunities like congressional briefings, panel opportunities, which we do a lot of, and other advocacy opportunities as they come up. These champions can focus really on the relationship building with their lawmakers who consider them really trusted experts in their field. And they could also focus on recruiting newer advocates to IDSA and HIVMA. Next slide. So here's the QR code that I was mentioning. So this is a great moment for you to take out your phones and join. So the top advocates are extremely dedicated to advancing our policy priorities, and they're great champions. And we're very happy to have the individuals that have supported us this entire time. I mean, passing the biopreparedness pilot program was a big achievement that's not necessarily on staff. It is the fact that we have a great pool of advocates who are making sure that Congress is hearing your voice. And as Rubita mentioned earlier, from last year, we really doubled the amount of individuals who are on MAP, which means that our impact on the Hill is even greater. And now it's really, can't stress enough how important it is, especially when it comes to the work that I do, when it comes to HIV funding. Funding for Ryan White programs has been flat funded the last several years, and we're hearing from providers on the ground that they're already stretched thin and at capacity. Those individuals who are in the Ending the HIV Epidemic initiative targeted jurisdictions, which provides grant funding to areas hardest hit by the epidemic. The last two Congresses, the House proposed to cut all that grant funding going to your state, going to your city on prevention, treatment, and surveillance. So it's not until Congress hears from your voices that they learn the direct impact that their decisions have on their constituency, and we really need your voice to be able to do that. So we would love for you to join the ranks of MAP and include you in this fantastic network of ID professionals, and to connect you with the work that we are doing here on Capitol Hill. If you have any questions, please let us know, and you could email us as well at advocacy@idsociety.org.
Great. Thank you so much, Rabita and Jose. It looks like we did get a few questions in the Q&A. Really quickly, Jose, if you can answer, where can someone see how many points they have for MAP? That would be great. You can answer that live really quickly.
Sure, that is a great question. So as soon as you enter the tier of the map, we let you know how many points you have and which tier that you on. We have a congratulatory email that comes on when you sign on. Also, as you move your ranks up to champion, we also have a Champions Digest. So those champions who want to know a little bit more of the nuance of policymaking or the details of the National PrEP program or Pasteur, we're able to provide you that additional communications and content for those individuals who are really interested in advocacy. So you'll be receiving an email from the IDSA and HIVMA team as you move up through these tiers.
Thank you so much, Jose. And I see that we got a few questions in the chat, some of which, if we have a little bit of time at the end, we can just go back through and answer. So really quickly, we'll go ahead and advance to our last presenter. It's my pleasure to introduce you all to Amy Shapley-Farrell. Amy has been a nonprofit professional for over 15 years and currently serves as the Workforce and Professional Development Program Manager here at IDSA. She focuses on the IDEA Incubator program in the microbial pathogenesis and Alzheimer's grant, among other items. Amy, take it away.
Thank you. So it's so nice to be this afternoon, and I do have the pleasure of working with two of our programs. So the first one I'm going to share with you is our IDEA Incubator program. If you want to go ahead and go to that slide, it's a pitch style competition, so it's very exciting. And we look at different ideas that are aimed at changing the face of infectious disease and improving patient care. And so there's been some really exciting things that we've been able to fund since 2018. We've given out over $87,000, and we are increasing the award amounts this year, so that's very exciting as well. You can go to the next slide. Some examples of the types of work that we have funded. One of them in 2019 was Mark Sindak, who created a software model called Sepsis Watch that predicts sepsis within 4 hours. And that software that we were able to fund at the beginning of the development is now has been running for over 4 years, is primarily at Duke University hospital system or health system, and they're expanding to other healthcare systems. And then in 2020, and that was a second place winner. In 2020, our first place winner was Holly Frost and her team, and they developed a code for antimicrobial stewardship method to get feedback to clinicians that were prescribing for outpatient in outpatient settings with limited resources by generating reports that work with the EMR systems that the physicians were already using. And several entities are currently using that code, and they are working on creating a public web page to download the code for open access. So it will be broadly available. And on the next slide, we're going to show a video that just shows a brief clip of our 3 finalists from this past year, which is a new thing that we did, is the pitch videos, but you'll get to hear what their innovations were.
Vote for us to use the ocean to overcome AMR.
Vote to improve the care of HIV in the rest of the world.
Vote for us and help us connect people with HIV and opioid use disorder to the high-quality care they need.
So you can see that we have a broad areas of interest and types of innovations, not just use of technology, but our 3 finalists last year had very different types of innovations. One was an actual test that can be used in low resourced areas to test for drug resistant HIV. That was actually our first place winner, and our People's Choice Award, our Innovator of the Year and People's Choice Award winner. There's also an app that helps people navigate the healthcare resources available for people who are both opioid dependent and HIV positive. And then there's also a compound that is used to work with AMR and biofilm. And so some very different types of innovations. You can go to the next slide. So who can apply for this award? It can be anyone who is an IDSA member and non-members who have an ID solution that's novel and innovative. So we have a lot of physician scientists that apply, as well as others who have ideas. So 2 of our finalists last year were ID doctors, and the other team that was a finalist was not ID physicians. They were scientific researchers. So the applications that we judge on are a well-defined statement of need. So we really want to see that there's something that this is going to solve, a problem that we have in the ID workforce, the ID field, the scale of the problem, the number of patients or individuals who can be served, and the cost benefit analysis. So what is the impact of this work? Also having a very clearly defined population that we're trying to target, the potential of the innovation to really expand and solve the need of that population, and the overall health impact beyond just ID. Our primary focus is ID, but how can this be expanded broader? You can go to the next slide. So we have 3 award categories, and this year the award winner for each category will receive a $10,000 cash prize. So the first is patient care and practice. The second is technology and telehealth. And the third is diagnostic technologies for unknown pathogen identification. And more information can be found about each of these award categories on our website, or on the foundation website, actually. And then those 3 will go and compete in a pitch competition that's live at ID Week in Los Angeles. And the winner of that will receive an additional $5,000 cash prize, as well as an accelerator package, which I'll talk about in just a minute. And then the People's Choice Award is the winner with the most votes for their pitch video. So we saw just a brief clip of the pitch video, but we create a full pitch video for each finalist. And then those are voted on by the general public. You can go to the next slide. So those who get the accelerator package receive coaching and support. They receive coaching while they're developed. All of the finalists, so all of the category winners, will receive coaching as part of their video development and live pitch development ahead of the live event at ID Week. And then the Innovator of the Year also receives the accelerator package, which is a business mentorship package through SCORE, as well, which is an organization that provides business mentorship specifically. And also we provide information and trainings about accounting, marketing, filing a patent, establishing best corporate structure. So we are not experts in those fields, but we connect them to the experts so that they can get that information and launch their business or take it to the next level. You can go to the next slide. So the timeline, this application period is currently open until June 30th. And the link to our applications is on the website. And those will close on June 30th. Then they will be reviewed by a panel of ID physicians. The finalists will then be notified in July and receive coaching and support to prepare for their live presentation and their videos. And then we will promote them through September and October for the voting for the People's Choice Award. And then the Innovator of the Year live finale will take place at ID Week in Los Angeles. So that's our IDEA Incubator program. Again, it's open to anyone who has an actionable idea to change how we deliver care or how we provide testing or other aspects of ID care. So you can go to the next slide. The other program that I get to work with is a mouthful, but it's the Microbial Pathogenesis in Alzheimer's Disease program. And this is a research grant program. You can go to the next slide. This program promotes novel research to explore the potential link between infectious disease and or chronic disease and Alzheimer's disease. And so our researchers look at things from prevention, cause and prevention to treatment. And so there are a lot of really interesting innovative types of research that have been done since 2018. And these grantees, we will be publishing updates on all of the grantees since 2018 on our website very soon. So you can go there in the near future and look at all of the outcomes that they've produced so far. But it also connects the pathogenic research community of Alzheimer's disease with other researchers, other types of research. So we have folks who are looking at bacteria, we have people who are looking at immune responses, we have people who are looking at viruses. And so we connect those folks as well. So not just within their discipline, but between disciplines. You can go to the next slide. So we've had some really great outcomes since 2018. We have had 261 applicants. We have provided funding to 46 grantees. Some of those grantees have been funded more than once. So to continue their research after their initial funding. We've had applicants from 31 countries so far, and we've awarded $5.6 million in grant funding. This is a competitive grant process, so we have a 21% acceptance rate, and really a narrow difference between how the level of scores on the research proposals between those that are funded and not funded. So it is very competitive. We do have an NIH style review panel that meets, who's interdisciplinary medical researchers who look at all of these applications and then score them and then have to make the decision on who is funded. You can go to the next slide. So since from 2018 to 2024, our grantees have had 30 manuscripts published of their research that we've funded, and there are additional 15 pending manuscripts currently. They have provided at least 48 presentations nationally and internationally of their research, and have procured or secured additional $12 million, over $12 million in additional funds to continue their research. That includes NIH, NIA funds, as well as other research grants. You can go to the next slide. Our program has also had some big impacts. We have an inaugural issue, supplemental issue of the JID coming out this fall. And 7 of the 10 manuscripts that were submitted were from our current or past researchers, but there are additional 3 researchers that were the primary author that were not our researchers. And that will have 5,000 print copies mailed out, as well as the online readership. You can go to the next slide. We also had a research symposium last year, which was our first of its kind that we had hosted. And we looked at potential interventions and research development in this area. And we had around 50 participants. It was a pre-meeting to ID Week, and 10 of the 12 researchers that presented were our grantees. And we also had a panel discussion on NIH funding and how to further the work in this field with the funding. And we do plan to have another one of these symposiums this coming year in 2024 at ID Week. And so we're really excited about that. You can go to the next slide. So our program activities really focus on 3 areas. So we don't just give out funds. It started out as a program where we were just passing funds to researchers to look for this link. But as we worked with our grantees and saw what their needs were, we've really developed an overall program that wraps around not just the research, but the other needs of the community. So the first area that we work in is convening the community. So we have an online community hub that has professional development opportunities, networking opportunities. We share conferences and funding opportunities, and really just keep them connected with each other and with the bigger space of this area of research. We are hosting another symposium this year, and so we're very excited about that. We are currently accepting abstracts for that, and that information can be found on the foundation website as well. And then we have our special issue of the JID. And then we do continue to fund research. So we really focus on potentially actionable research that can move the field forward. And so one of the things that we're focusing on is how to build the research that's already been done by our grant community, as well as looking at what are some new and innovative ideas coming into this research. So we do fund at various levels to be able to accommodate that. And then we also engage with partnerships to integrate the pathogenic and traditional research spaces and provide grantee support so that they can engage with the broader Alzheimer's community. You can go to the next slide. So who can apply for this funding? It can be IDSA members and non-members. We do fund different levels of investigators, and we fund academic and health researchers from all disciplines. So we fund both PhDs and MDs. We do fund interdisciplinary research, including collaboration between experts in Alzheimer's research and experts in infectious diseases, and really try to help build those connections moving forward. So we have funding specifically this year to connect folks doing research at different points of disease or different points of research. And then we fund clinical and basic scientists across a wide range of health-related fields, including infectious disease, neurology, microbiology, pathology, immunology, virology, and neurosurgery or neurology. And then we are open to both international and US citizens as well. So we have folks who are in Australia, currently Uganda, Australia, Canada, and Cyprus are in our current funding cohort, as well as the US. You can go to the next slide. So our timeline for 2024, we anticipate opening applications in late spring, and then reviewing in July, with funding starting in September. And we do have our 2nd annual Science of Alzheimer's symposium scheduled for the week of ID Week in 2024. And that's all I have. If anyone has any questions, but I'll turn it back over to Ayana.
Awesome. Thank you so much, Amy, for that wonderful presentation. I think we are pretty much on schedule, but I wanted to check the Q&A really quickly, just to see if there's any questions that we can answer immediately. And I see that folks have been responding, so thank you all for answering the questions directly in the chat. Awesome, thank you. So yeah, thank you to all of our speakers today. This was a phenomenal presentation. If there are any questions that we missed, or if there are any questions that you have, let's see here. Let me try to turn up on my camera. There we go. Please feel free to, again, reach out. I'll have my email address at the very end of the presentation. Thank you for our audience for your attendance and your participation. Doesn't look like we had any participants from our MARS group, our mentorship and recruitment subcommittee, but thank you to all of the IDSA staff who participated. If you wish to revisit the webinar or share it with others, again, the recorded session will be made available both in Cooper. Oh, I think we do have one question. George, if you want to go ahead and pose your question.
Yeah, just a plug for the Fellows Day workshop for the mentorship program. So it's a pre-meeting workshop, the first day of the meeting, and it goes from 8 to noon, and they do case reports, and then they also have, like, I don't know, probably 8 or so workshops, for people interested in doing ID, and it's mostly fellows, but it's also, I think, good for residents. And that goes from 8 to noon. And last year it did not interfere with the luncheon for the mentorship program, because I think the luncheon started at noon on the same day. So we went right from the fellows workshop right into the mentorship luncheon. And so I don't know if there's any formal interaction between the fellows workshop and the mentorship program, but there's like a lot of overlap there in terms of sort of the goals of each program. So I wasn't sure if there's actually like a direct interaction between the mentorship program and the Fellows Day workshop programming.
That's a fantastic question. Amari, do you have any thoughts about that? I don't think we've traditionally had any overlap or collaborations with the Fellows program.
Sure. We have done some sort of backdoor collaborations with the fellowship program, but not any direct programming. We're hoping to be able to do a little bit more of that as we move forward with our mentorship activities across IDSA and sort of standardizing them and pulling them together, which will, of course, kind of bleed over into what we do at ID Week. But it's a really good question.
Yeah, because I noticed in the chat that the luncheon might be starting at 11:30, and so I think last year it started at noon. So that worked very well for the workshop, because the workshop was done at noon, and then we just all walked over to the mentorship luncheon.
Yeah.
Just wanted to make sure there's no conflict there.
We will definitely keep that in mind for this year. Thanks.
Thank you so much.
Thank you, George. I appreciate that. For our next webinar, it's scheduled for May 23rd. Let's see here. It's at 3 p.m. It's going to be on mental health and self-care for ID physicians, kind of in celebration of Mental Health Awareness Month. So I will drop the link for you all to register for that in the chat. And if you, again, we'll be posting all of our information about any upcoming webinars to Cooper, but we've also been sending them out on our social media channels and directly via email. So we will send everything to you moving forward via email, and then you could just follow us on social media to connect with us there. So if there are no other questions, we can go ahead and wrap it here. Thank you all again and for joining us, and I hope you have a wonderful rest of your day. Thank you.